already in pain. Pakistan's living through a never-ending nightmare. 10-month-old Saeed lost his home in the floods. Now he's fighting for his life. As his mother Noor watches on, doctors give him an urgent blood transfusion. He's suffering from a severe case of malaria.
We're really poor. I'm worried for my child. I feel helpless that I can't do more for him. Our homes were flooded. Since then, everyone seems to be getting malaria.
Including 2-year-old Saima, who we meet in the next bed along. Her grandfather Ghulam brought her to hospital from his submerged village far away.
You can see I'm really worried. We are struggling to get proper treatment. She's had diarrhea and she has a fever all over her body.
Almost everyone on this ward has fled from the floods, and almost every patient here is young.
And this child with this patient, this is 5-year-old female child.
As Dr. Ashfaq explains, living in the open has left thousands even more vulnerable, displaced and in distress.
Because of this surrounding water, there are so many mosquitoes. Not only this malaria, but they are spreading dengue as well. We have too much burden now of this malaria cases. But now we have malaria treatment only for 3 days.
Pakistan's healthcare system is struggling to cope with an influx of waterborne diseases. A country already ravaged by the floods is now facing a medical emergency. And even when these patients recover, many don't have a home to go to. Not far from the hospital, large swathes of this province remain underwater. Rural Sindh is the worst affected area, and one of Pakistan's poorest. Hundreds of thousands have set up shelter on this riverbank. Families who came here seeking sanctuary, now struggling to stay alive. The risk of disease, the latest burden to those who've already been left with nothing. Rajini Vaidyanathan, BBC News, Sindh Province.